Hello everyone, good morning. Today we are continuing our session in dermatology for USMLE. So today we will be talking about some breast conditions and Staphylococcus aureus in burn patients and about Pseudomonas. I will tell you in detail and very clearly how to differentiate each breast in diseases depending upon the vignette that has been asked with the certain words that has been described in the vignette. So let's start with Staphylococcus aureus. Here you should know that any infection with Staphylococcus aureus, they will be oozing out a liquid or a fluid in yellow color. So you can remember it as golden staph. How will this knowledge be asked? A teenage boy with the burn injury from firecrackers developed yellow colored infection at a burn site while hospitalized. So they will ask you, what is the diagnosis? The diagnosis is Staphylococcus aureus because the infection is yellow colored infection, and for this reason it is also called as golden staph. The wrong answer is Pseudomonas because Pseudomonas will result in pyocyanin pigment which will cause a blue-green coloration. What about the breast infection? Breast infection is that there is a condition known as mastitis and abscess. So here in mastitis, the question will be like 25-year-old female with a red cracked fissured nipple, and what is the causative organism? The causative organism is Staphylococcus aureus, and the condition is known as breastfeeding mastitis. Here any disease which is caused by aureus is treated with oral dicloxacillin. And can breastfeeding be continued? Yes, the breastfeeding can be continued. Now you need to know that in mastitis, in the mastitis itis, it shows that there is inflammation of the breast, isn't it? So therefore, because of the inflammation, the breast will look warm, the breast will be tender, the breast will be erythematous, the breast will be a red mass in an upper outer quadrant or whatever quadrant, but the key distinction is it will be non-fluctuant. Mastitis will be non-fluctuant. So which condition is fluctuant? Abscess, breast abscess is the condition which will be fluctuant. This is the first point that you should know regarding the differences. The second point is that mastitis that is nothing but it is an infection of the breast, isn't it? It can occur both in breastfeeding mom as well. Even if the lady is non-breastfeeding, she can develop an mastitis. So this is the second point. You should not confuse when they give a non-breastfeeding female. In that case, you should not think that it may not be mastitis. So mastitis can occur in breastfeeding as well as in the non-breastfeeding females. Then there is another condition which is known as Galactocele. Galactocele, as the name says, there is collection of milk per se, right? So therefore it will be tender, it will be fluctuant mass, but it will not be warm or red. So after stopping the breastfeeding, the milk is being retained within, thereby forming a milk retention cyst, which is known as a galactocele. But the infection has not occurred into it. So therefore it will be tender, it will be painful, it will be fluctuant, but it will not be red, not will be erythematous, it will not be warm, there will be nothing, because it is not an infection. So it is a milk retention cyst, but it is not an infection. That is known as galactocele. Okay. What are the other breast conditions which are associated with the nipple changes? There is a condition, there are three conditions. First one is ductal ectasia. Here, because ectasia is dilatation of the lactiferous ducts or widening, isn't it? So because of the widening of the lactiferous ducts, it is resulting in an inverted nipple. So when the female presents with inverted nipple and she is deeply worried whether she might be having a breast cancer, here it has no association with breast cancer. It is just widening of the lactiferous ducts resulting in an inverted nipple, which is the condition is due to ductal ectasia. The second condition is Paget's disease of the breast. So here here it will be like red eczematoid nipple and there will be a palpable mass. So when they have an eczematoid nipple as well as a palpable mass, that is known as Paget's disease of the breast, and it is often associated with underlying ductal carcinoma. What about the third condition? Third condition is inflammatory breast cancer. 65-year-old female with purely orange appearance of the and erythema. When there is purely orange appearance, then it directly points towards breast cancer. This is because the purely orange appearance is caused by lymphatic obstruction affecting the Cooper's ligaments. The Cooper ligaments are being pulled and resulting in an inflammatory breast cancer. Let's see about the acne treatment algorithm. The first treatment for acne is topical retinoids, because the topical retinoids per se will inhibit the sebum production and it will control the acne. But on the downside, it will result in a photosensitivity as well as peeling. The second treatment is topical benzoyl peroxide. It will clear the pore, it will kill the bacteria, and it is mostly co-administered along with the retinoids. The third line, when both of them doesn't work well, then we are supposed to treat them with topical antibiotics such as topical clindamycin. After that, it is followed by oral tetracycline or oral antibiotics. The last resort is the oral isotretinoin. It is used for severe acne. Fine, but the thing is, oral isotretinoin will is a teratogenic. Therefore, before starting oral isotretinoin, pregnancy test has to be done. If oral isotretinoin is done to a male patient, and if you ask whether they have any teratogenic risk, no. Oral isotretinoin does not affect the sperm count, or it is not teratogenic when administered to male. How do you diagnose retinoid-induced photosensitivity? Sometimes they will give you a cases like 20-year-old female who's on acne medications with a characteristic forehead rash. This is acne, but they will be giving you a forehead rash. In that case, it is due to the forehead rash is due to retinoid induced photosensitivity. So the management will be avoidance of sun exposure. What is another drug which will cause photosensitivity similar to retinoid? It is tetracycline photosensitivity, which will present with blistering and not just erythema. So they will be giving other options such as avoid spicy food, avoid stress and all those doesn't contribute to this. The reason for blistering and the reason for erythema is due to retinoid as well as tetracycline. What about tinea faciae? Tinea faciae, we know that tinea is a dermatophyte, and when it occurs in the face, it is new to faciae. So here, in the tinea dermatophytes, it is other than the scalp as well as the nail, it is treated with topical azoles, mainly miconazole as well as clotrimazole. So topical antifungals like miconazole and clotrimazole are the first line treatment in tinea faciae, in tinea corporis. So 2 to 4 weeks is a typical duration of time. What about Waterhouse-Friderichsen syndrome? Waterhouse-Friderichsen syndrome is caused due to Neisseria meningitis. The invasive Neisseria meningitis infection, it will result in bilateral hemorrhagic necrosis of the adrenal cortex. Because the adrenal cortex is no more functioning properly, we need to treat the condition. They will be presenting with a low BP because of low adrenal hormones. We need to treat them with adequate fluid resuscitation, and then hydrocortisone should be provided. How will the Neisseria meningitis that is causing Waterhouse-Friderichsen syndrome present? Do they present with any skin rash? Yes, of course they do. They will be presenting with a skin rash somewhat similar to it. So when you have a low BP with this kind of skin infection, then you should immediately think that it is due to Neisseria meningitis. Without treatment, they will proceed to death. Now, how will they ask you this? How will they test this knowledge? They will be giving you that a child who's having a fever with a stiff neck with low BP, and the following image will also be shown. What is the most likely organism? The organism is Neisseria meningitis, which is a gram-negative diplococci. What is the diagnosis? Diagnosis is meningitis with a characteristic non-blanching rash which is caused by Neisseria meningitidis. Will it present with low BP? Of course, the low BP can be endotoxic shock, but it will also be due to Waterhouse-Friderichsen syndrome. The other important condition is Neisseria gonococci. How will Neisseria gonococci present? Neisseria gonococci can present in two patterns. Either it will present as monoarthritis of the large joint, that is the knee, or it can present as either polyarthritis or tenosynovitis or cutaneous papules. So they will present with all three manifestations. So the organism is gram-negative diplococci, that is Neisseria gonorrhea. The case presentation will be 23-year-old male with soreness in the left knee, right elbow, positive Finkelstein test, and there is a cutaneous papules on the wrist. Positive Finkelstein test will point towards tenosynovitis. So here this is how the question will be asked, and you should know that the answer is gonococcal arthritis. What about a typhoid fever or Salmonella typhi? Mostly the question will be like an immigrant, a female who's recently immigrated to US from India, and there are rose spots on the abdomen, presenting with severe constipation and fever. So question asks, how is this condition acquired? You should know that this is due to typhoid fever and it is due to ingestion of fecal contaminated food or water. The diagnosis of Salmonella typhi or a typhoid, humans are the reservoir. It classically causes rose spots on the abdomen plus prostration. Prostration is nothing but patient is lying supine and is in pain. It can cause diarrhea or it can present with constipation. So this is caused by Salmonella typhi. You should know that the other Salmonella species, that is Salmonella typhimurium and enteritidis, which are classically acquired from the eggs or the poultry or reptiles. So in the Vignet, you simply will like to include turtles or lizards, and in that case you should know that they are talking about Salmonella typhimurium or enteritidis. What about the gas gangrene? We all know that the gas gangrene is due to Clostridium perfringens, which is an anaerobic gram-positive rod. They will be asking you like, what is the other disease which the Clostridium perfringens can do, or they will be giving you a typical vignette where they will be telling you about a typical case with a gas gangrene, and they will ask you what is the other disease or other condition which the organism can cause. You should know that the gas gangrene is due to Clostridium perfringens, and it will cause gas gangrene, and it can also cause watery diarrhea. What is the virulence factor? It will produce lecithinase, and it will present with subcutaneous emphysema or crepitus. What about ecthyma gangrenosum? Ecthyma gangrenosum will present with this, but what is it? It is really an uncommon cutaneous infection which is caused due to Pseudomonas. It is mostly seen in poorly controlled diabetes. This is known as ecthyma gangrenosum. What about anthrax? Anthrax is nothing but it is mostly seen with those who handle pet birds. So it will also be almost similar to this, where they will be having a characteristic black eschar with a surrounding edema. So here the anthrax organism is also gram positive, similar to our Clostridium perfringens, and it produces an edema factor that will increase the cyclic AMP. What do you know about Listeria monocytogenes? Listeria monocytogenes is again gram-positive rod, but it can cause severe prenatal infections. What is the prenatal infection? When the pregnant woman has acquired Listeria monocytogenes, she can have a stillborn who has diffuse granuloma on the body. So how will the vignette be? The most common risk factor for Listeria monocytogenes is soft cheese and deli meat. They will expose the Listeria monocytogenes, or they will transmit the Listeria monocytogenes to the pregnant female, and they will have a baby who is suffering from granulomatosis infantiseptica with diffuse cutaneous granulomas. What do you know about Francisella tularensis? Francisella tularensis is that organism which will be presenting with an ulcer like this. So how is this acquired? It can be acquired through pet rabbits. it is highly infectious. It only causes very minimal organisms to cause the disease. So either it can have a present with cutaneous ulcerative lesions, or it can also present with bilateral atypical pneumonia. So rabbits are the source of infection. So any question where rabbits are involved, it means that they want you to know that they are talking about Francisella tularensis. What do you know about erythrasma? Erythrasma is nothing but it is that condition which is caused by Corynebacterium minutissimum. So when it mostly affects the intertriginous areas, preferably the axilla, and they will be having a bright coral red fluorescence under Wood's lamp. What is this condition? They will test you like 40-year-old male who have painful erythematous lesions in her axilla, and the image is shown. What is this and what is the treatment? The diagnosis is hidradenitis suppurativa and the treatment is surgical excision of the lesions. What is this condition? It is nothing but there are apocrine glands which are present in the groin as well as the axilla, where they will remove the apical part or the bud off and they release the secretions. They are the ones which is responsible for producing the odorous secretions, whereas merocrine and eccrine are the glands which are the normal sweat glands. Holocrine glands are the glands which is responsible for producing sebum, and they will secrete the sebum as such per se. The whole part of the gland will be secreting. So that is the holocrine. These are the three main important sweat glands. When the apocrine glands on the hair follicles become obstructed, then the blocked structures will become inflamed, forming tender abscesses. So these tender abscesses will form as tunnels develop under the skin connecting multiple abscesses. So repeated inflammation leads to permanent tissue damage, therefore resulting in hidradenitis suppurativa. Therefore, in hidradenitis suppurativa, the treatment is surgical excision of the tract. So thank you for listening all this while. I am happy that you have come to the end of the slide. I hope this is helpful to you. If you have any questions, you can write to me. I am more than happy to clear all your doubts. I have an announcement for you. I am starting my mentoring lessons for medical graduates and USMLE aspirants. If you like my videos and if you like the way I teach, you can sign up for my mentoring class. I can't wait to see you succeed. Thank you. Have a good day.